Symptoms of a damaged liver. Liver is the largest solid organ in the human body and one of the most important organs. It is located in the right upper quadrant of your abdomen and partly protected by your ribs. You need your liver for important functions in your body and you can't survive without it. This is the main reason many medical experts around the world say that you should be very careful and that you should not ignore these early signs of a damaged liver. Experts say that there are more than 100 different kinds of diseases of the liver and each has its own set of symptoms. Listed below are the most common early signs of a damaged liver. 1. Jaundice. Jaundice is a yellow coloration to the skin, tongue, fingertips and eyes. It is from increasing in bilirubin in the bloodstream and in the bodily tissue that would normally be excreted in the bile. You should also know that bilirubin builds up when old red blood cells are broken down inside the liver, and this usually causes the skin to become yellow. Jaundice can also mean you problem with the pancreas or gallbladder. 2. Abdominal pain. Abdominal pain is usually pain in the right upper quadrant of the rib where the liver is located. When the liver is malfunctioning, there can be pain or tenderness in the affected area. 3. Alteration in the color of urine. You should be worried if you drink plenty of water every day but still have a dark color of your urine. Don't ignore this early sign because unfortunately you may have a problem with your liver. The urine may look brown, amber or orange in color because of elevated levels of bilirubin in the bloodstream. The bilirubin is elevated because the liver cannot get rid of the bilirubin and it is excreted through the kidneys. Dark urine may also be due to dehydration, side effect of taking antibiotics, taking vitamin B supplements, urinary tract infection, enzyme deficiency or kidney abnormalities. 4. Lack of appetite. Lack of appetite usually happens due to lack of production of bile that helps digest the fat in the diet. When food isn't properly digested, it can lead to lack of appetite and weight loss. See your doctor if you experience lack of appetite for a long period of time. 5. Fluid retention. You should be very careful because the experts claim that this is one of the most common sign and symptom of liver damage, especially if you suffer from fluid retention in the ankles and the feet. This is similar to ascites except the fluid is building up in the outer tissues in the lower extremities. Other causes of fluid retention include hormonal imbalance, heart failure and lymphatic disease. 6. Nausea and vomiting. Nausea and vomiting can also be an early warning sign of liver damage. Yes, they can mimic other diseases such as migraines, food poisoning, vertigo, motion sickness and early pregnancy, depression and vomiting and kidney problems as well. So the people who suffer from liver damage often usually nauseous because the liver has a decreased ability to get rid the toxics. 7. Intestinal bleeding, diarrhea or constipation. Your liver makes clotting factors and without them you can get bleeding associated with diarrhea or constipation. 8. Hormonal imbalance. Men should be very careful because damaged liver can cause hormonal changes in men which can cause some serious side effect, loss of libido, grow breasts, etc. 9. Abdominal changes. You should be very careful, and if you experience pain or cramping in the lower part of abdomen or feels especially bloated, this can mean that you have ascites or malfunctioning liver. Ascites is one of the early signs of liver damage and basically means that fluid has built up inside the abdominal cavity. It can happen whenever there is damage to the liver or liver cirrhosis. Ascites can also be caused by disorders unrelated to the liver, so you should seek medical attention if you develop this symptom. 10. Increase in the skin itching. The experts say that your skin usually becomes more sensitive when your liver is damaged, and it usually causes itches, flakes, and you are hypersensitive to touch. You should also know that you may experience an increase in bruising and an increase in the visibility of the veins in the body. You can try to keep the skin moisturized with lotion, but the itching and skin sensitivity probably won't get better until the actual liver problem is properly identified and taken care of. 11. Change of stool color. When your liver is damaged, it won't produce enough bile, which means the color of your stool will change. Instead of being brown, it will become pale yellow, clay-colored or gray in appearance, so if you notice this, seek medical attention. 12. Fatigue and overall weakness. One of the most common signs of liver damage is fatigue and weakness. When the liver isn't working properly, your body must work harder and you will need more rest. This is due to increase in toxins in the bloodstream that can't be cleared out because the liver can't get rid of the toxins properly. If the symptoms persist, especially with other early signs of liver damage, seek medical attention.